And I remember having a conversation with the editor of the BMJ, Fiona Godley, who's an amazing inspirational woman. But I remember having a Zoom, because we became friends, and there was all this. By the way, when I published this paper in the BMJ, there were calls for retraction. I went on trial, right, for effectively 2 months, which could have destroyed my career. We came back 6-0 in our favor in terms of a unanimous decision, me and another guy called John Abramson at Harvard, who wrote the same thing about side effects on statins. And the guy that instigated that was a guy called Professor Rory Collins in Oxford. And he's probably considered one of the most powerful men in medicine, not just in the UK, but in the world. He wasn't happy with that BMJ, this independent review. He then tried to get the editor of the BMJ sacked. It was really hardcore. And I was a junior doctor who'd written a peer-reviewed opinion piece in 800 words and took down in that the sugar industry, the statin industry, nutrition scientists who were dogmatic, right? So you can imagine I was getting it from everywhere, but it still stood up to scrutiny.
Ladies and gentlemen, first of all, have you had a good day so far? Somebody's speaking about being a health warrior, and just by show of hands, how many of you have heard of an amazing, amazing health warrior by the name of Dr. Aseem Malhotra? Yeah, awesome, right? And I think he's paved the way for so many of us to speak out and do some amazing things. And I remember when we announced that we were having him, people were like, "Whoa, no way, dude! Really, Dr. Aseem in the house?" And he's here, and we're going to get through about 30 minutes. I'm going to interview him from stage, and then we're going to do some Q&A. So if you have some questions to ask, make sure you have those ready. And when I ask, not if, when I ask if you have any questions, please have them ready. Okay. And then Dr. Aseem has kindly said that if you guys are really quick, what's the word, please? If you're quick, we can squeeze in some photos. Pretty cool, right? So he's got a servant heart, and he's got a big mission, and we're so excited to have him in the room. Ladies and gentlemen, please, without further ado, on your feet, and welcome to stage, Dr. Aseem Malhotra.
I'm on fireball.
All right, have a seat.
Fireball.
I saw, I came, I conquered.
Okay, cool. Doc, welcome here. Welcome. It's awesome to have you here.
Thanks for having me. What wonderful energy. Very different, I've got to say, to the energy in the room in the British Parliament 2 days ago when I gave a speech. That was a bit more subdued. But I like the vibe here. It's nice.
Apparently, you just come off the back of winning an award. Do you want to tell us about that? Yes?
Yeah, it was just, for me, these are, I think, symbolic of the fact that at least someone's listening to a counter narrative which is more honest and more truthful, and the fact that it's gone to the levels of, politicians, etc. It was called the Global Health Awards. It's relatively new, but basically it was linked to some very influential politicians. I won't name all of them, who organized this, and they've been watching and observing, what I've been doing, what I've been saying. They haven't necessarily been very vocal, but they thought this was an opportunity for me to give a keynote speech first and foremost, and then I got an award as well. So, and as you know, I don't mince my words. I went in there thinking, these are the people that need to hear what I have to say. And I think what was interesting, what I've learned in this journey with certainly exposing the corruption of medicine, and in particular the issue around the COVID so-called vaccine, which most of you probably know is not a vaccine, it's a genetic therapy. What happened afterwards was even more interesting, because there were some very senior scientists there from Imperial College and doctors, and they were absolutely gobsmacked with what I said, but they didn't come at me with a kind of sort of angry, "What are you saying?" They were like, "I didn't know this." Like, honestly, the data some of the stuff I mentioned, they had no idea. And that just, again, is a reflection of the fact that we have people living in echo chambers, but also the success of the mainstream media campaign to, through censorship and suppression of dissenting voices, is so effective that most people, although things are changing, most people weren't, they swallowed the narrative they were given.
Yeah. Well, actually, if we could start right kind of from the beginning, because you were the COVID vaccine wasn't the first thing you were outspoken about. And so if you give us a little bit of a history for those who don't know, kind of the cholesterol, the beginning. If you will tell us a little bit about that, you were a junior doctor, and then you discovered some pretty cool things. So maybe fill us in there.
Yeah. Okay. So background, just to summarize, I qualified as a doctor 2001 at Edinburgh Medical School. I subspecialized in cardiology. I was noticing working in the front line in the NHS, and I trained in intervention. So for people that don't know what that is, it's like stents, heart attacks, that kind of stuff, keyhole heart surgery. And that was my passion. I was eating, breathing, sleeping this stuff for years. But what I was noticing over a so-called, I would say, a 10-year period after qualifying, is I was noticing more and more stress on the system. I was noticing more chronic disease. I was noticing more my colleagues being more stressed. And of course, simultaneously, we're hearing all this stuff around the obesity epidemic and diet-related disease, etc. So that's really where my sort of personal investigation started. And when I looked into, and just where did that revelation come? I think probably for me, there were lots of things happening, but one of the main what triggered my line of inquiry that led me to this conclusion that evidence-based medicine has become hijacked by big pharma was the discrepancy I was seeing with patients who were coming in who'd had heart attacks and were on statin drugs, and the amount of side effects that I was diagnosing in them, and what was actually in the published literature. Big discrepancy, right? So published literature saying less than 1% maybe get muscles fatigue or side effects. I was seeing that much more commonly. And why was I someone maybe that was picking it up more than not, every doctor's different. For me, I pride myself on that conversation between my patients in the sense that having good communication skills and listening. If we're taught at medical school, and this is true, 80% of your diagnosis comes from the history, from the conversation. That is key. Not from tests, not from examination. I mean, that's where things are going wrong in medicine, and we see America as a result of just how they've got so much healthcare expenditure and worse outcomes, partly because they've lost the ability to focus on the basics. So that's part of how I was trained. So when you go to the history and you start talking to the patient properly, they start complaining all these things, and you think, hold on, what's going on here? So that's how things started. And then once I looked into all of that, I then looked at the cholesterol hypothesis, started reanalyzing the data. I was listening to there were other people out there as well who were saying similar things. And then it all culminated really in 2013 with me writing this article in the BMJ called Saturated Fat is Not the Major Issue. Because if it was quite clear that saturated fat from things like red meat and butter and all that kind of stuff did not cause heart disease when you look at the totality of the data. But we know saturated fat does raise so-called LDL cholesterol, bad cholesterol. So I thought, well, hold on a minute. If saturated fat doesn't cause heart disease, then it means LDL cholesterol probably isn't a significant risk factor for heart disease as well. So again, started analyzing all of that data. But then, okay, well, if cholesterol isn't a significant risk factor for heart disease, then how do statins work? And this is the most lucrative drug, one of the most lucrative drugs in the history of medicine. $1 trillion industry. And but what I did know, and this is where I was probably unique in putting all the bits of the jigsaw together, is in cardiology for years prior to 2010, we would prescribe statins to patients without even checking their cholesterol. Most cardiologists don't even check patients' cholesterol when they come in with heart attacks, right? They don't see any point because we're just going to put them on a statin anyway. And it was known within cardiology circles that statins had what we call pleiotropic effects. Essentially, they were anti-inflammatory, anti-clotting. So I was like, this makes sense, because if you look at data on studies prior to statins, for years, once there was this so-called cholesterol hypothesis, which really came about from something called the Framingham Heart Study, and then it started in 1948. And then Ansel Keys, who was a nutrition scientist, who basically thought that most of the heart disease could be explained by our diet and saturated fat, is that when they started doing drug trials on cholesterol-lowering drugs, all of them failed. So rather than stop and question the hypothesis, and we must be getting it wrong or we're not getting the cholesterol lower enough, then statins came about and they started to show outcome benefit. They started showing there was a prevention in heart attacks and strokes and death, albeit very small, yes. Right? And that's when it just sort of compounded this whole cholesterol hypothesis to the extent where, and it's so ridiculous, even 2011, there was a publication in one of the American cardiology journals done by a cardiologist called William Roberts. And it was actually called, It's the Cholesterol Stupid. And he wrote, you can be an obese, diabetic, sedentary smoker, but as long as your cholesterol is low enough, you will not get heart disease. I mean, how nonsensical is that? But the reason I'm telling you this is that indoctrinated belief is still very prevalent amongst many, if not most, cardiologists around the world. So all they care about is getting your cholesterol as low as possible. And this has been reinvigorated recently on the back of the so-called success of the COVID vaccine, which has apparently saved millions of lives around the world. So because of that, Big Pharma, and I predicted this would happen, their aim, their goal is to get as many people taking as many drugs for as long as possible. That's how they make money. So the next sort of most lucrative drug are cholesterol-lowering drugs. So this is another challenge we have now, is now we've got to fight back against all these people, and you may be seeing it yourself, some of your patients may be on cholesterol-lowering drugs, is that this is now the next big challenge we have. So I don't know if that kind of answers the question a little bit, or...
Yeah, it does. I'm really interested. I tell you, I'm really interested though in when you published that study. Were you a junior doctor? When you
Yeah, I was actually a specialist. I completed my training, but I hadn't got a consultant post.
Okay.
And I was in Croydon University Hospital at the time. I just started there, and I was the interventional fellow. So I was basically being trained up to be the guy that does all the stents. And I was, I'm not blowing my own trumpet here, but I was a very able interventional cardiologist to the point where I was essentially doing all the cases, and the consultants were in their room having a cup of coffee, and I was literally just doing them myself, doing all the stents, etc. And I was good and I was safe, and they were happy.
Actually,
right?
That's where I wanted to jump in and say, what do you think in you made you dig deeper? Because you could have been good, safe, and I guess there's so many doctors go into medicine to help people.
Yeah.
And I guess the intentions we have to assume are good, but there must be a lot they're ignoring. We all know that, like intuitive. But what do you think about you that made you go deeper and not be able to ignore it, perhaps?
I think going back to what I said at the beginning, first and foremost was I had an interest, but a very rational interest in trying to understand why was population health getting worse. And then once I realized what was going on, and specifically, I've said this publicly as well, I think this cholesterol hypothesis, in a way, this flawed cholesterol hypothesis is actually at the root of most of what's going on wrong with people's health. Because of that, you get the low-fat diet movement, high carb, high sugar, all of that then kicks off. So why... so that was a general interest of mine.
Yeah.
But then attached to that, Ryan, is a sense of duty and responsibility and a intrinsic, and this is in my nature since I was a kid, probably from my father, I know hatred's probably not the right word, but a very strong aversion to injustice. Right? For me, this was a gross injustice being inflicted on people and patients. People are suffering unnecessarily. As part of my nature, I can't stand to see people suffer. And that's part of just who I am. So I think that if you combine that with my critical analysis skills and then also not being afraid to speak truth to power, partly I probably got that from my dad. I mean, it's interesting, you call this, it's a health warrior event.
Yeah.
I'm born a Hindu, although most of a lot of what's happened the last few years, I've become very spiritual in the sense I needed that to protect me from all the stuff that was coming my way and also losing all my family, etc. But within Hinduism, there is traditionally something called the caste system, and my caste is Kshatriya, which is actually the warrior caste.
Oh, wow.
So I'm descended from warriors.
Wow.
So I think there's probably something there as well with that.
There's a lot of synchronicity.
Yeah,
That's awesome.
Yeah.
Well, I guess if we close up, that was your entry into, let's say, being brave enough to speak out. Just 2 or 3 stats that we should know as primary care physicians. We meet with people every day who are on cholesterol and who are on statins and have those challenges. So you, in one of your recent podcasts I watched, you mentioned quite some alarming stats. Like the percentage of side effects from people who stop statins, and the net effect of statins. This idea that statins are going to help you live longer. You've got a stat on that. That's pretty alarming too.
Yeah.
If you shared with us a couple interesting or a couple pertinent points that would help us, if you will, make the argument, I'd love that.
Yeah, no, it's a really good question, really important one, because this is what I'm about to tell you is actually what every doctor should be telling their patients. So take heart attacks aside for a second. Most people around the world, and it's estimated between 200 million and 1 billion people globally are prescribed statins. Okay? Most of those people are what we call not at high risk of heart disease. And when a patient comes to me, I engage in something which is very controversial. It shouldn't be. It's called ethical evidence-based medical practice and informed consent. All right? So for me, I've been someone that's been writing about it. I'm not just someone that's kind of just some blogger that's just speaking my mind. I've engaged with the medical Royal Colleges, 2015, with the BMJ. I coordinated a campaign, and the co-authors of that paper, and I was the lead author on it, was the chair of the medical Royal Colleges and the chair of the General Medical Council. So arguably the 2 most important doctors in the country. The point I'm making there is when I had those discussions with the Royal College presidents and said, this is what the major issue is, with the BMJ, obviously their campaign, which has been amazing, it wasn't difficult to convince them that we should do something about it. Yeah. So within that informed consent situation, if a patient comes to me and say, doctor, should I take a statin? Now, within the gold standard of shared decision-making, when you look at the literature on shared decision-making informed consent, there are several criteria, okay? And one of those criteria, which is essential, is discussing uncertainties with the patient in the evidence, right? Because this is another important point. Medicine is not an exact science, not even close. Okay? It's an applied science. It's a science of human beings. It's a social science. We are not machines. We're not like, we are very complex and we are dynamic and we change even from day to day. Okay? So there has to be some humility also. We start from that position as doctors. So what are the uncertainties when it comes to statins in any drug? And I always tell the patients this, and I put it in every single clinic letter, which, by the way, goes back to their GP, goes to whoever, other specialists. I've not had a single complaint. I mean, I'm sure complaints may happen, but I'm lucky, maybe. But I've not had a single rebuttal or someone coming back to me saying, oh my God, this doctor's wrong. And in that discussion to the patient, I say, listen, first and foremost, I say, what I'm about to tell you comes from drug industry-sponsored data that has never been independently verified. I tell that to the patient. And they want to hear that. And I say, they're there to make money. So I say, this is likely best case scenario. If you take the statin drug every day religiously, and you don't get side effects, because in the trials, they took people with side effects out before the original trial started, that are therefore not mentioned in the final results. Most doctors don't know this, and we did not get taught this at medical school. So that's why the patient also has to understand why they're getting some other information from their doctor. So I said, if you don't get side effects and you take the drug religiously, I said, best case scenario is it gives you a 1% chance, 1 in 100 chance of it preventing a heart attack or stroke without prolonging your life. So that's really important information to give the patient. And then it's not about don't take a statin. I say, how do you feel about that? And every patient is different. Not surprisingly, most of them will say, Doc, I don't really fancy those stats. Yeah, I don't really want to take the drug. I say, how do you feel? Would you like to take the drug? And they're like, no. I said, great, okay. I will write in my letter that I've had this discussion with you, and I'll write, I fully support your decision in keeping with the principles of ethical evidence-based medical practice and informed consent. So coming back to the stats about population level, if you look at the clinical trials in another way, and you can look at the statistics differently, the question is, how much longer will you live if you're taking a statin? And this is in people with heart disease who've had a heart attack. Where if you look at an individual level, the benefit is 1 in 39 in preventing a further heart attack over 5 years, and 1 in 83 in prolonging your life, right? But if you take an average, what's the so-called median life expectancy increase over 5 years in taking a statin in people who are the highest risk in heart attack patients, it's just over 4 days. Now imagine, I've been at conferences throughout the country over the years, and I've had hundreds of GPs sitting in the audience, and I ask them the question before I give them the answer. Like, what would you think? What do you expect? 20 years, 5 years. And I put out, and this is drug industry sponsored research, by the way. There's not independent research. This is a drug industry's own data, published in the BMJ, and you get gasps from the GPs. They are shocked. They don't know this stuff. So then, on that point, taking that further, separate study actually looked at how much have statins reduced. So have millions more people taking statins from, say, 2000, 2010 across Europe. Has it translated, when you try and cut out all the noise, into reducing death rates from heart disease? And the answer was no. So how do you explain that, even if you've got a 4-day increase?
Yes.
Is that in the real world, up to 50% of patients will stop taking their statin within 2 years. And when you ask them why, they say it's because of side effects. So the translation of the trial data into the real world, you can actually make a case, and I say that, is that statins have not reduced in the population heart disease.
Or a net benefit of any kind, in fact.
No, and then you add in all the side effects, and then you add in something else, which is where you're focusing on so there's another way of looking at it, is I actually say that the focusing of lowering LDL cholesterol and prescription of statins in the current paradigm has actually increased heart disease risk.
Wow.
Because it's given people the illusion of protection.
Yes.
And distracted them from more important lifestyle changes, whether it's low-carb diet or whatever.
Yeah. Well, actually, you mentioned John Ioannidis a few times. And to quote you, he said most medical research findings are wrong. Is that right?
2006, +1, most cited medical research paper in history.
Is John Ioannidis?
Ioannidis, absolutely. And it's titled, Why Most Published Research Findings Are False.
So is he talking about peer-reviewed public research?
Yep. Yeah.
Why? How can he say that?
What he does is, so John Ioannidis is a professor of medicine and statistics at Stanford. Again, the most cited medical researcher in the world. Mathematical genius. He got like the gold medal in mathematics at the University of Athens, I think, right, in Greece. Okay, this guy is an absolute genius. Very good with statistics. Looks at data. Looks at how data is analyzed, the methodology, risk of bias, who sponsored it, everything. So he wrote this paper and he put all these different calculations in, and he took the gold standard of what is going to be accepted as completely, solid, true results, and then he basically ticked, he took a sample of God knows how many studies, and random sample of studies, and then he basically calculated how many of them adhered to the gold standard of true evidence-based medicine, and most of them did not. So that's why he said most. So does it mean they could be partially true? Yes, but ultimately, another way of looking at this is that if we accept that the drug industry's primary motive is to make profit, and that they control the data essentially on the studies, right? So they design the studies, they do their own analysis. They have their own people writing up most of them being the co-authors that then publish in the so-called biblical truth journals that we were taught in medical school to believe as an absolute truth, like the New England Journal of Medicine, right? You got to. So when you understand that, you then come to the conclusion very clearly that what is published in the results is going to grossly exaggerate the safety and the benefits of those particular medications, and that's the reality that we're in. So none of this is going out live today, is it? Okay, fine. So I'll give you a heads up. Okay, so this is between us, not to be only because I don't want to jinx it. But I tell you what, I'm going to give you just a bit of the information. A major newspaper. This is good news, by the way. A major newspaper, mainstream newspaper, not a tabloid, interviewed me last week for a big feature article that is going to be published tomorrow.
Wow, that's cool.
All right. And
I imagine you held back.
What's that?
Oh, yeah.
Well, it's interesting to see what, because you do these interviews and then, what they end up publishing and what you said, and it's not a hatchet job. I'm sure it's not, but they may leave some stuff out.
Yes.
But what I said to them, the reason I'm mentioning this is, I said, it's time, because he asked me about Ozempic, this weight loss drug. And by the way, I'm sorry, it's absolutely, I won't swear,
You can.
effing horrific drug. I wouldn't give it to my worst enemy. Okay? You lose, and by the way, what's so powerful about this propaganda is I know many people who didn't take the COVID vaccine who said, I don't trust pharma, blah, blah. And they're taking fucking Ozempic now.
Yeah.
That doesn't make any sense, does it? Right? Well, it does make sense because, again, it's vanity and it's weight and whatever. I get that, okay? This is like psychological barriers to the truth, right? And it's willful blindness and all of that. We're all vulnerable to it in different circumstances. But I said to him, I wouldn't give it to my worst enemy. I said, nobody should have it. And I said, what we need, I said, when you see what's happened with the COVID vaccine, I think if we don't realize now, we should basically say no to every new drug unless it's independently verified. Yeah. No doctor should prescribe any new drug from now on unless the data is independently verified.
I think
it's so extreme because the COVID vaccine has caused serious harm and killed, and I can back this up with solid data, millions of people around the world.
I think it's appropriate time to switch to the COVID vaccine.
Right? No, it's a crime against humanity, and it's a symptom of a system failure, which comes back to, again, the economic system. That's the root cause of the problem. We shouldn't be even picking on one industry and one product. We have to go to the very root cause of the problem. Yeah. And I said no. I said no. Just say no. From now on, everybody, public and doctors, need to say, I'm sorry, because that's how you change. This is the revolution we need. Do not comply.
So, do you want to unpack for us a little bit, because your story is really interesting and your whole background is really interesting. But you when COVID came out, I wouldn't say you were for the COVID vaccine, but you had the COVID vaccine, and then would you want to unpack that for us a little bit, and then how that led to where you are now?
Yeah, really good point that comes up. So I had the reasons I took the COVID vaccine were multifactorial. I didn't think I was at risk. I had a father who was, we just lost my mum like 2 years earlier. And I was very, very close to my father, who was a GP. And he had this very grossly exaggerated fear that I was going to get COVID and die. Even though I'd spent 2020 doing analysis and even advised Matt Hancock on links between COVID and obesity, et cetera, et cetera. So I knew I was very, very low risk. And we actually, but there was a couple of things. One is, I think, despite everything that we talk about with the failures of modern medicine, the corporate capture, there was a blind spot on vaccines in general. And I remember having a conversation with the editor of the BMJ, Fiona Godley, who's an amazing, inspirational woman, I think, who really launched this whole campaign of too much medicine with a major medical journal, realized and published. I think the BMJ have been amazing. She obviously has left now. But I remember having a Zoom, because we became friends, and there was all this. By the way, when I published this paper in the BMJ, there were calls for retraction. I went on trial, right, for effectively 2 months, which could have destroyed my career. We came back 6-0 in our favor in terms of a unanimous decision, me and another a guy called John Abramson at Harvard, who wrote the same thing about side effects on statins. And the guy that instigated that was a guy called Professor Rory Collins in Oxford. And he's probably considered one of the most powerful men in medicine, not just in the UK, but in the world. He didn't like he wasn't happy with that BMJ, this independent review. He then tried to get the editor of the BMJ sacked, right? So it was really hardcore. I remember meeting some staff members of the BMJ, and I was a junior doctor who'd written a peer-reviewed opinion piece in 800 words and took down in that the sugar industry, the statin industry, nutrition scientists who were dogmatic, right? So you can imagine I was getting it from everywhere, but it still stood up to scrutiny. The reason I'm saying this is obviously when all that happened, I got to know the editor of the BMJ very well. And when COVID happened, I remember we had a Zoom, and she said to me, Fiona, she said to me, Aseem, there's part of me that's a little bit uncomfortable about us being, going very pro the COVID vaccine. And I said to her, Fee, your campaign is against too much medicine. It's not against all medicine, right? Because, again, we were misled to thinking we just went with the narrative. There's something called hindsight bias. You look back now. But at the time, I was open-minded, but I wasn't seeing anything credible coming from any credible sources, like the people like John Ioannidis or whatever else, or Peter Gersher, who's the co-founder of the Cochrane Collaboration, who has been, exposing all of the corruption in Big Pharma. All these people were very pro the COVID vaccine. So the people I looked to,
I didn't know that.
no, they all were. There was none of the people that I'm aware of that have been the leaders in the field in the last 3 decades exposing corruption in Big Pharma. None of them were questioning the COVID vaccine, with the exception of maybe one person, and that's Peter Doshi, the associate editor of the BMJ. All right? He was asking questions a little bit. But anyway, to answer your question, so blind spot on vaccines doing any harm. Like, I couldn't envisage how can a vaccine cause harm. I don't know of any. I mean, part of what inspired my work was my patient interactions. I'd never come across anybody that was vaccine injured or told me they felt they were vaccine injured. I didn't know of anyone that was vaccine injured. So again, it wasn't in my radar. So I didn't expect any serious harm, but I knew I didn't really need it. And I ended up basically having an argument with my dad. I remember I had the first shot and I didn't feel right after it. And then he insisted I have the second shot, right? And it was in Manchester and I was in London. I remember going to Manchester and I just didn't want to have it. And we ended up having almost a row outside the vaccine center. And he was scolding me like I was a disobedient little child, a boy. Like, this is like Indian father, but I'm very, very close to him. And I just like, you know what, fuck it, I'll just go and have it. So this is what happened. Having had it, again, I had one of my friends, and we've been very open about this, is a famous film director. She's Britain's leading female film director called Grinder Chadha. She did Bend It Like Beckham, you might know of, and a few other films like that. And and some of these celebrity figures come to me for advice. And she came to me and she said, Aseem, I'm not really sure about the COVID vaccine. And she had some risk factors and she's a bit older. And I said, Gurinder, to be honest with you, I'm not very sure about the efficacy, right? Because most of these, even the flu shot is not very effective. I mean, it's pretty crap, to be honest. And I said, for vaccines for respiratory viruses aren't very effective. I don't think this is going to be particularly efficacious. It might have some benefit, on a population level. But I don't see any harms. That's what I told her. I can't see any harm. So she took it. And then she tweeted out that she'd had it. And Good Morning Britain knew both of us and said, would you come on? It was February 2021. Because there was data coming out that people from ethnic minority backgrounds their uptake was quite low. And the reason for that actually is quite obvious, is that people from ethnic minority backgrounds, a lot of them are some of the most marginalized members of society. So they're the ones that have the least trust in government. So when they're being told, they're like, no, thank you. So I went on Good Morning Britain, and I didn't go there pointing the finger saying, oh my God, these people. I didn't do a Tony Blair, oh my God, if you don't have the vaccine, you're an idiot. I didn't say that, nothing like it at all. I said, actually, there are rational concerns here. I said, look at what Big Pharma have been doing for years. Look at the fraud they've been doing, blah, blah. But I said, when it comes to all the things that we do in medicine, I still believe this to be the case. No drug or vaccine is completely safe, right? But if you look at all of the drugs, you line them all up, traditional vaccines are the safest. Having said that, I think the COVID vaccine is probably the most horrific medical product in history. But traditional vaccines, in comparison to everything else we do in medicine, are the safest. And that's pretty much what I said. I did get asked back on Good Morning Britain, by the way, because I think they wanted me to be a bit stronger. And I reflect on this as well. I think doctors, if we make a mistake, it's very important. Patients want you. If you're well-intentioned, patients are forgiving, right? If you cover up mistakes, they're not forgiving at all. So for me, I've said this before. I would be, and we were all indoctrinated to a large degree, but I haven't had anyone come to me, even on social media, and say, Dr. Malhotra, I took the COVID vaccine because of you and I'm injured. And if they ever come, I will apologize to them. Thankfully, that hasn't happened. Yeah. But that's really the circumstances. Okay. And then the revelation, quite a long answer there. Number of different things happened. One is I didn't feel right myself. Something felt a bit off with me physically. There was a lot of other things going on in my life at the time. I was being persecuted because of my statin stuff. So 2019, I lost my job in the NHS because a Mail on Sunday did a hatchet job on me and two other scientists, which was a front page piece, which basically around statins, and they call us statin deniers. And the editorial said, a place belongs in hell for doctors that say statins don't work, and there was a picture of me in there.
Wow.
And they got the Secretary for Health, Matt Hancock, to say there's no place in the NHS for people like this. Interestingly, Matt Hancock, I'd met him a week earlier, and he didn't know they were referring to me, so there was a message exchange. The two other people sued the Mail on Sunday. I kept out of it. My mum had just died. I didn't want to get involved in a libel campaign, whatever, against the Mail. I thought it wasn't worth it. And actually, they won their libel case last year.
Wow.
So there's a moral victory, but I lost my job and never got it back. So I was already a bit on the back foot. And I was under a lot of stress. I just broken up. I was in this relationship that didn't, that it was a bit toxic. I just broken up from that relationship. And I'd had the COVID vaccine. And within weeks, I went into moderate to severe clinical depression. And at the time, I didn't attribute it to the vaccine, but it probably had played a role. So I wasn't in a good place. And then this went on, obviously, for a few months. I was doing all sorts of different things, concentrating on meditation, doing Pilates, whatever. I started to get better. And I got better. And during that time, when I was getting better, I went to meet a friend of mine who I consider one of the brightest cardiologists in the country, very high integrity, very clever guy, one of my juniors when I worked at Harefield Hospital. And he said, Aseem, I just got to tell you, I didn't take the COVID vaccine. I said, oh, I was curious. I wasn't like, you're an idiot. I was like, oh, why? He goes, there's something that troubled me in the appendix of Pfizer's original trial. He said there are 4 cardiac arrests in the vaccine group and 0 in the placebo. 4 cardiac arrests in the vaccine group and 0 in the placebo. He said it's small numbers, not statistically significant, but he said that's a bit weird. He said if this is a real signal, we're going to see a problem. We're going to have a problem. I wanted to wait. I'm low risk. I said fine. So I lodged it in, kept it in the back of my mind, but I didn't really think much about it. But it was still there. 26th of July, 2021. My father, who's fit and well, 73-year-old guy, calls me up and said, Aseem, I've got chest pain. And it sounded cardiac. I told him to call an ambulance. He was in Manchester, I was in London. And it wasn't severe. It was about a 6 out of 10. And he said, I'm going to call my neighbors. I said, why? What's the point? Your neighbors are doctors. I said, no point in calling them. He said, you need an ECG. You need an ambulance to come to do an ECG. And if there's an issue, and even if there's not an issue, you've had it for 40 minutes, you're going to have to go in and get blood tests, etc. He was reluctant. And I got in the shower to get ready. I said, okay, I'm going to come up to Manchester because I knew he was going to be in hospital probably anyway, just to observe him. I didn't think there was going to be any significant, but I was just like, it sounds cardiac. It may be angina, whatever, Call him back. No answer. I keep calling. Eventually, the neighbor who's a doctor answers the phone and she's hysterical. And she says, Aseem, your dad's had a cardiac arrest. We're doing CPR on him. Her and her husband, who's also an anaesthetist at the local hospital, were there. They witnessed it and they, called an ambulance. I said, okay. They were getting ready. And I said, listen, you've called the ambulance. It's a witness cardiac arrest. He's very lucky. There's going to be at least a 60% chance he's going to survive because he's going to have a shockable rhythm and the ambulance will be here in 8 minutes. The ambulance took 30 minutes. And I FaceTimed him to see my father flatline, nothing to shock. I said, you need to stop, right? So obviously, 2 things to mention. One is, why is the ambulance delay? I then got involved with a journalist with the I newspaper and did an investigation, and we found out. And then someone senior, a whistleblower from NHS England, contacted me and said that the Department of Health and the government had been covering up ambulance delays in the whole country for several months. So I then exposed this. It became a BBC News story. I got a post-mortem done on my dad because it didn't make sense that he'd had this cardiac arrest. I knew his whole history inside out. I knew his cardiac history. And basically, there were 2 severe blockages and did not make sense to me. And then 3 months later, there were 3 bits of data that made me basically completely U-turn, if you like, and investigate the whole COVID vaccine stuff. One was a publication in Circulation, in the journal Circulation, which was done by a very senior, respected cardiologist in America, who is really involved in lifestyle stuff. He's called Stephen Gundry. I don't know if you've heard his name, but he basically does, this lectin diet, and he's all into the whole lifestyle stuff. And he basically found through use of inflammatory markers, and what was happening was he got all these people on this really healthy lifestyle, reduced their cardiovascular risk. And because I met him later on, and he said, Aseem, a lot of my patients were contacting me saying that their inflammatory markers in their blood had gone up dramatically. And there's lots of them. He's like, this is weird. So the only thing, so he did this study and he found within 8 weeks of having the COVID vaccine, mRNA, their risk of heart attack went from 11% risk at 5 years to 25% in 8 weeks. Linked to the COVID vaccine. And he thought, oh, So he published this, and I was like, because heart disease is a chronic inflammatory condition, this makes sense. So it's accelerating heart disease. I straight away said, this is going to accelerate heart disease. This explains what happened to my dad. And then it was confirmed with other patients I was seeing. So there was that. Then I got contacted by a whistleblower at the University of Oxford, who said a group of researchers in his department, he was very distressed, had accidentally found through a heart imaging modality, there was a signal of inflammation in vaccinated people of the coronary arteries, which was not there in the unvaccinated. But the lead researcher, this is Oxford John Radcliffe University Hospital, by the way, all right? The lead researcher got his team together and sat with them and said, we're not going to explore these findings any further because it may affect our funding from the pharmaceutical industry. So that's number 2. Data point number 3. 2 months earlier, before I was familiar with this, because then I was like, putting it all together, a Times journalist contacted me and said, Dr. Malhotra, since the summer of 2021, we have an unexplained 25% increase in heart attacks in hospitals in Scotland. What do you think is going on here? And I actually said to her, I said, listen, with everything I know, I could have predicted there's going to be an increase in heart attacks because of lockdown stress, the stress of the whole pandemic, and people's diets got worse. So you can, and that can actually cause even a rapid change. But once that data started coming, when we got these 3 bits of data, that's when I went public. I went to GB News and said, this needs to be looked into. Straight away, there was backlash behind the scenes. Royal College of Physicians had a number of complaints. And by the way, I'm still mourning the loss of my dad. And they contacted me saying, Dr. Malhotra, we've had a number of anonymous complaints from fellows. I was a fellow of the Royal College of Physicians at that point. And they're saying that you're an anti-vaxxer and you're spreading misinformation. So this is so weird. Imagine this. I'm good on, 9 months earlier, I'm in Good Morning Britain telling people at high risk take the COVID vaccine. I've taken the vaccine myself, and now I'm an anti-vaxxer, and I'm causing harm.
Yeah.
So this is how. So then I thought, you know what? This is so big, and this may even be career destroying for me. I said the only avenue here, right? Imagine the whole world, indoctrination, everybody thinking this has saved so many. I said the only thing I can do now is I can do what I've done before with all my campaigning and activism with sugar, on statins, on low-carb diets, whatever, is go through a peer-reviewed journal.
Yep.
And then if that gets accepted, when I've done my own critical analysis to see the benefits and harms, if that gets accepted and go through peer review, I then throw the kitchen sink at it and amplify it through all my use of the media. And basically that's what essentially I tried to do at the end of 2022. However, and I'm not going to name this journalist because it's not fair, I've done a lot of work with him. I had an exclusive with one of the most influential newspapers in this country, and I knew if this becomes a news story, it's game over in the world, right? COVID vaccine causing harm. Because I knew how these things roll, how they said, if that happens, that's done. And I lined up the exclusive for him. He was all ready. And the day before we're going to the press release, he comes back and says, Aseem, I can't do this. He says, the British Heart Foundation say this. The British Immunological Society say this, right? He's gone to them for comment. Now, normally that wouldn't be an issue because you go always, with everything I've done, you always get comments from other people. So that's fine. Let them give their comments in the piece. But they wouldn't touch it. And I was absolutely gutted. And that's when I thought outside the box. I said, listen, one of my inspirations is Mahatma Gandhi, right? And he says, you make the injustice visible. So what can I do here other than social media? And that has a role to play, but that isn't enough. So I thought outside the box. I managed to get it into the mainstream news in India. It got in the Spanish newspaper. And then, we had GB News at that point. Okay, it's still something.
Yeah.
And that's really when things kicked off.
Right. So I want to segue into some questions because I want to be respectful of your time.
Yeah.
But just to close off that section, you said a stat there a moment ago on the death rate or adverse reactions to think. Can you repeat that for us and just tell us?
I'll tell you why.
Yeah.
So there's lots of studies out there. People can get confused. What's true, what's false, what's reliable, what's not reliable. The most important study, which I keep citing, and that's really is very difficult for even my detractors to rebut. They just ignore it, okay? In the summer of 2022, in the journal Vaccine, which is the highest impact vaccine journal in the world, there was a reanalysis published of Pfizer and Moderna's original trials. So these are the trials that led to the approval by the regulators and the rollout and then the coercion and then the mandates. And the reanalysis showed by very eminent scientists, including the co-author was the associate editor of the BMJ, Peter Doshi, is that from the very beginning, from the randomized, when everything is this is supposed to be the most robust way of doing a clinical trial, okay? Double-blinded, randomized, all that stuff. Everyone's equal in both groups in terms of their baseline demographic risk factors, et cetera, et cetera. They found you were more likely to suffer serious harm in the vaccine group at a rate of 1 in 800, short term, by the way. That means disability, life-changing, hospitalization, death, than you were to be hospitalized with COVID in the placebo group.
So your chance of going to hospital went up after the vaccine.
Not just that, disability or life-changing or death, right? So basically, serious harm rate is much higher than being hospitalized with COVID,
Yes.
which means that most likely, if this independent analysis had been done from the very beginning, not done by our regulator in the UK that gets 86% of its funding from Big Pharma, it would not have been approved for a single human in the first place. Now, if you extrapolate that 1 in 800 figure, which is a minimum, and you say that 3 billion people have taken the COVID vaccine globally, that means you've seriously harmed or killed 3 million people. And that's an underestimate.
Yeah, of course it is. Everyone take a deep breath in. Do that. Take a couple questions, and then we're going to be respectful of Dr. Aseem's time. So, Monica, if you grab a microphone to Monica there. Quick little question. Monica, let's do one clap. Monica, ready?
Thank you so much for that info, fellow warrior cast. I met Peter McCulloch in October of 22. Do you have any conversations with him over combined or collaborations or findings that you've both confirmed?
So people who don't know, so Pete, thank you. Peter McCulloch is a cardiologist in the United States, brilliant man, brilliant scientist. He didn't take the vaccine and has been very vocal on calling for this moratorium, and it shouldn't have been approved. So we're very much aligned. I know Peter well. I consider him a good friend. So after I published my paper in September, and by the way, it's open access. So people can ask, well, how did I even get this published? There's a journal which is actually it's all very much focused on lifestyle, called the Journal of Insulin Resistance, now the Journal of Metabolic Health. And there were 3 reasons I went for this journal. 1 was it doesn't take any funding from pharma. 2, it's open access. Whatever I write, I didn't want to be behind a paywall. And 3, it was the only journal that would allow me to write 10,000 words. Because there were 2 parts. 1 was analysis on the COVID vaccine, and then it's like how we got it wrong, why we got it wrong, and what the solutions moving forward, right? Which is all my background prior to all of this. And when I published this paper, September 2022, I was invited actually to go on a speaking tour of America, a few places with Peter McCulloch, to answer your question. So we are very much aligned, certainly on the COVID vaccine stuff. And yeah, I think he's a brilliant man. So in terms of collaborations and things, yeah, I mean, other than us speaking together and supporting each other, certainly on social media, he's got involved now with something called the Wellness Company, and he's trying to do his best to use supplements to help people who've got long COVID and vaccine injury, and I think they definitely have a role. It's not something I would have got involved with. They asked me to be part of it, partly because for me, my, how should I put it? My approach to all of this is that I deliberately will not endorse products for financial reasons because I see it as a personal conflict of interest, and it stops me being an independent voice. I'm very happy to support certain supplements, whatever else, but I will never take money or whatever else be associated. And so I said, listen, I'm happy to, advise my patients to try your stuff. But I can't be part of all of that. So that's why there's no sort of collaboration with that kind of direct collaboration with him. But to answer your question, no, I think he's really good.
That's awesome.
One very last quick question. Who is your chiropractor?
Ooh,
Now you're.
I am open. I'm open. I don't have one. I don't have a chiropractor.
Yeah.
So if you're offering, then
She's definitely offering. Just to say, if it wasn't clear, she's definitely offering. There you go, Monica. There you go.
Yeah.
Good job. Okay, another question. Okay, Jack. So Benny.
Just suggest that we are at the tip of the iceberg when it comes to the effects of COVID and also the COVID vaccine. And certainly, since I've been in practice, I'm sure everyone in the room has experienced this as well, that conditions that people are coming in with now are taking a little bit longer to get better, and certain conditions are certainly being exacerbated. Cancer patients who have now got turbo cancers and what have you. And I've been working very hard with a company which has actually developed an organic form of ivermectin, which we're doing some amazing stuff with and giving great hope to people. Sorry for the plug for myself there. If anybody's interested, I got some in the car. Do you think that ultimately those who made the catastrophic decisions regarding COVID and the whole build-up to that and the decisions also latterly, do you think that they will be ever held accountable?
One thing that I found, so the answer to your question, the short answer is absolutely. The question is, how long is it going to take? I think more than accountability, though, because obviously that puts blame. I think accountability is important when people have acted nefariously. But I think that what is more important than pointing fingers at individuals is understanding the system that makes good people do bad things. And that's called corporate capitalism. And this is something I have to keep mentioning again and again and again. It's the current form of corporate capitalism. You know, the free market principles, which I'm very supportive of. Adam Smith was considered the founding father of that. And this makes logical sense, by the way. You can even apply it to how we even practice medicine. Markets function best on perfect information. It makes sense, where the payer and the transactor know exactly what they're getting. With drugs, it's the complete opposite.
Yeah.
Right? So we have to make sure that we have a system where you have honesty and transparency and accountability for people who are in positions of power that are then going to influence population. So that needs to happen. How long is it going to take? It has to happen very, very quickly, in my view, because as you've already alluded to, there's a massive health crisis right now. And without acknowledging the mistake, we can't then start to implement solutions, which means also all of the best scientific minds in the world saying, okay, most people have taken this. Many people are asymptomatic and probably maybe even at risk, potentially of cancer or heart disease or whatever else. Can we look for what's the best test we can design to see who's at risk, and then what can we do about it? And it's great that people are doing things like, for example, yourself and other people are trying to help people. But ultimately, we need really good quality data to understand who's going to be at risk, and of course, what the benefit and harms of different interventions we need to do. But in terms of and this is going to probably shock you, and I will be writing about this soon. In 2012, the German Medical Association, you can Google this, you can read it yourself, they put out a statement basically apologizing for the role of the medical profession in the Holocaust. And they wrote words to this effect: most people believe that the main instigators and the execution of the Holocaust was politically done by Hitler, etc. That is wrong. It was done by the medical profession. And we're apologizing 70 years later. Wow. Because it all started with doctors, first of all, forced sterilization of people of Jewish origin or people with disabilities, and they were even instigated behind the whole Xylon B gas and everything else. 45% of the German medical profession joined the Nazi party versus 7% of teachers.
Wow.
And separately, a publication in one of the Israeli journals, public health journals, in 2019, before the pandemic, actually put a warning saying lessons from the Holocaust. And they had said there's actually questions to be asked. They were a bit more circumspect about what they said, but they said there were questions to be asked about whether the Holocaust would have happened at all if it wasn't for the complicity of the medical profession. And they put a warning in there saying there is a cultural problem within medicine, which is hierarchical and obedient, which is a risk factor for abuse of power. And they said this applies to many different things, including informed consent. And then see what happened during the pandemic.
Oh. Good. Last question. Street, go for it. Here in the front.
Thank you, and thank you so much for everything you've done for, the world now. Monday morning, you've given a lot, you've sacrificed a lot to try and help the health worldwide. What could we do on Monday morning to help support that action? What would you like us to go away, to take away, and how could we help the mission? What would be most useful?
It's a great question. I get asked this all the time. All of us, and I suppose all of us have to be the best version of ourselves. And being the best version of yourself also starts from, acting with the right conduct. What can we do in this situation? I think people who are awake and aware of what's going on, and it's not easy, right? Speaking the truth obviously has its. It's not safe to speak the truth, and it's to help people understand, and even ourselves, that not speaking the truth is even less safe because the problem gets bigger. So through every mechanism that you have available to you, whether it's social media, whether it's conversations with friends, with family members, is to try and get them to understand what's going on. And you can use resources. I think now that there is a bit more of a shift where people will not necessarily, they'll have their opinions about, a podcaster, but they seem to, and this is how things have worked very effectively for so long, is that they seem to be more open to stuff in the mainstream media. Maybe let's see what happens in the one of the major Sunday newspapers tomorrow. That could be an immediate thing. Is like, read this article, and maybe send them information that you found that was convincing or helpful to you. Send them to read that. I think that's the way that the conversation continues to get amplified. What else can we do? I mean, other things.
This morning we reviewed Simon Chapman's 10 rules.
Yeah.
And one of them, we said, the last one, if you guys remember, was the mainstream media is fleeting, meaning it's not, if it gets published tomorrow, it's going to be forgotten pretty quickly, so you need to jump on it if you do that. So we just reviewed, thanks to one of your podcasts, I came across Simon Chapman, and then we reviewed some of his stuff this morning. So this made me think about, if it goes live, you've got an opportunity probably for a week, really, where it's public consciousness, to then reshare it and chat about it.
The only thing about the mainstream media, which is slightly different, you're absolutely right, you have to amplify it, is what's usually written in the mainstream media, it has a knock-on effect amongst other media. So, for example, I wrote an article in The Telegraph it was before the summer of 2020. So I was the doctor that went vocal saying that Boris Johnson likely got hospitalized with COVID because he was overweight. Okay? And I wrote an article, right? And in the Telegraph newspaper, which is featured on the front page. As soon as that went into the Telegraph, I'm now on BBC News and I'm in Good Morning Britain.
Yeah, guys.
Right? And it then it has another effect. So I'm just saying that the mainstream media stuff gets amplified, especially for something like this. Certainly with Action on Sugar, as soon as the Daily Mail in 2012, I think it was, or 2013, 2014, January 2014, front page of the Daily Mail, because of what we've done with Action Sugar. Sugar is a new tobacco. I knew game over. I was like, we've won. Because that was also the Conservative Party were most fearful. The one paper that has the most influence over the Conservative Party is the Daily Mail. And that then instigated a meeting with Jeremy Hunt, and then suddenly we have sugary drinks tax, et cetera, et cetera. So the mainstream media still has a lot of power. But anyway, to answer your question, it's just having those conversations, amplifying it, use whatever resources you have, social media, friends, et cetera, and be tenacious. Don't give up. Just keep going, right? Just keep banging that drum. And also thinking about, and this is not easy because a lot of us can get frustrated and angry. I try and think about, if somebody isn't hearing me, okay, it's going to be partly them, but how can I improve my communication skills? So that they do listen to me, if I really strongly believe in something. How do I change the way I speak to that person? And it all comes back to actually speaking with compassion and humility rather than pointing the finger. That's what it's about.
I think that's an awesome place for us to say thank you for what you've done. I think we all in this room feel frustrated at times that we can see the injustice and it's clear as day, and maybe the lack of impact we've had sometimes when we think that, what can we do? But you've done that in buckets and spades. So you've given us an opportunity to amplify that. Would you guys agree? Dr. Aseem, thank you so much.